Hey, it's Jessica Damasa with WTF Health. What's the future of health? I talk to the who's who of health tech and healthcare innovation, and I'm doing a deep dive into what's changing with the patient experience. And I'm doing it here at Artera's first ever customer event, Heartbeat. So joining me right now, I have Ravi Patel. He is the Vice President of Digital Health from Lurie's Children's Hospital in Chicago. Ravi, it's great to have you here.
Thanks for having me.
I really want to dive right into what's going on at Lurie. So I think it's really cool to start talking about the patient experience, at a children's hospital, because it's just a different kind of patient. It's a patient and a family and so on. So tell me, what are the three big things that are like top of mind right now in terms of redefining the patient experience at Lurie's?
Sure. So I'll start with access. More important than anything else, especially in the pediatric space, access is becoming more and more difficult. There's less pediatric beds available. There's less children's hospitals out there. And as that's becoming more and more tight, our tertiary, quaternary care is becoming more difficult to access. So number one is access, and that's where Artera really comes in. It's our ability to be able to actually make sure that all of our patients show up to these appointments so that we don't have wasted appointments and then the next patient can actually get in. Second is really about the patient experience. Healthcare is complex. We don't have to pass all that complexity on to the patient and the family. There's a lot that they're going through with a new diagnosis or potentially a chronic diagnosis that they're having to manage. That complexity doesn't have to be passed on to the patient. Let's keep it simple for the patient. So where we can consolidate appointments, where we can make them more structured and multidisciplinary care is critical. Without being able to actually effectively manage the whole patient and all of the variety of specialties that they need to access, you don't actually have a simplified solution for the patient. And then third, I think probably more important than anything else is really having to make it an empathetic approach. In this complexity of healthcare, we're all trying to solve how to get the patient the right care that they need, and how do we do it in a way that actually makes it not necessarily enjoyable. I don't think anyone ever wants to get healthcare, but make it as least painful as possible. And so to do that, we have to figure out how to communicate. And that communication goes beyond just the interpersonal communication right in the middle of a physician's visit, but rather all of the pre-visit communication, all the post-visit communication, all of that full-on end-to-end experience. And so how do you make that whole end-to-end experience one simplified journey for the patient?
That's the big question, right, Ravi? I mean, that's what we're all working on, I think, right? And I think it's interesting that, the third thing that you mentioned is building not only just that routing, but also making sure that it has that empathy piece to it. So I love that. And one of the things I wanted to ask you, is specifically being at a children's hospital, it's like the patient isn't just like the patient, it's like the patient and their family. And so talk to me a little bit about like the caregiver as far as like helping, in terms of the thinking around patient journey. So it's like I often feel like the caregiver is left out of that completely. And it's not just children that have caregivers. I mean, if you're somebody who's older, if you are somebody who's suffering from a really serious disease, I mean, even if you're just somebody who has a family wrapped around you, I mean, caregivers are there. So how are you guys thinking about including the caregiver as part of the patient journey? And like what can general health systems learn from your approach in terms of making sure that the caregiver is included?
Yeah, I'll start with it's complex and it's really painful.
Great, that makes everybody want to do it.
In the pediatric space, it's really difficult because you have proxies. You have all of these patients, parents, guardians, DCFS in unfortunate cases. And so how do you actually communicate with those proxies that are out there? Defining the proxy is critical, and doing that up front is also an important factor. I think different platforms are getting better at that. They're actually allowing self-selection of proxies, and that makes this a lot easier downstream because now the patient, you can communicate everything to the patient. The patient can now independently make the decision of, okay, cool, I'm going to make this person my proxy, the person who's going to help coordinate all of the healthcare that I need to give as my caregiver. So in the pediatric space, unfortunately, you can't do that with a 5-year-old.
Right.
And so what we end up having to do is define those proxies up front. I think in the adult space, you have a lot more opportunity, and there's an opportunity to grow that experience up front. So in that first interaction, can we do a better job at defining those proxies? Are there people that are going to help you through this new diagnosis or this new navigate the healthcare system to provide the complex care that you're about to get? if you can figure out how to do that up front, you can now bring them along in the journey along with the patient. So that's really where it becomes a kind of critical unlock. Everyone is now all on the same page. Everyone's getting the same message. From there, then all that communication going back and forth becomes something that is one episodic experience at the end of the day.
All right, Ravi, digital health is in your title, and so I've got to ask about this. How do you decide where to put tech? I mean, especially in a process where, I mean, like we're talking about, these are sick children, and so there's a lot of need for empathy. Sometimes tech can be a little cold. So how do you decide where in the process you put technology?
So it really twofold is how I think about it. So one is does it make the patient experience easier? I don't really care about the bright, shiny objects. There's a lot of opportunity to get into the bright, shiny objects, remote patient management, monitoring. We're still trying to figure out what the return on investment is for some of those items and what that patient experience looks like. Is this just another device I have to carry around? Or is this something that's actually going to make my whole care experience easier? Because that's what technology is supposed to do. At the end of the day, it should make it a more facile approach for our patients. So if one, we can really focus on what makes it easier for the patient, and that then value can be generated. Sometimes it's non-monetary value, and that's fine as long as there's value being generated for the patient. It's something that is a good investment for the organization. The second piece is it's got to be something that is sustainable, and scalable more than anything else. Yeah. And so we can have all the technology in the world, but if I can only deploy it to 100 patients because it involves all of this complexity of coordinating care, and I need to have 6 people in the background coordinating the care for 100 patients, that's never going to be sustainable. I'm never going to be able to grow that from 100 patients to 1,000 patients, or even from 100 patients to 100,000 patients, and because that's what we're really targeting. We have about a 275,000 patient unique patients that we're interacting with over the course of a year, and as you think about all of those patients, we want to make sure that every patient, every time has the opportunity. And that's pretty much our motto from a digital health perspective. So whatever we roll out, the whole goal is to make it available for every patient. And they're only going to adopt it if it's making their life easier.
Yeah.
So
I'm curious to know, you mentioned ROI. I hear you get very passionate about the subject of ROI, especially when it comes to technology. So I want to hear, from you, like, okay, what are you looking at? Like, how long of a time period are you willing to give the technology, to generate ROI? And like, when it's ROI, is it really just like a monetary return? Is there an engagement piece that we're looking at? Like, tell me how you're thinking about ROI when it comes to the patient experience, and particularly with technology.
Yeah. So first is the short-term return on investment, and the long-term, more sustainable return on investment. So in the short term, I think most of our technology should have some immediate, at least hypothesis for return on investment. And that return on investment, as I said, could be monetary. And then in many cases, sometimes it's not. It has something to do with value of care. And that value of care can either be an improved patient experience, it can improve quality of care, improve safety in care. All of those factors weigh into that return on investment. I have to be able to see the short-term return on investment. And whether that be, okay, I've made it easier because I get that return right away, or I get the return on investment because I've made it easier for this patient to get in and thereby fill my backlog. All of that becomes something that we prioritize. That then allows me to invest on the long-term returns on investment. So there's things that we're going to go do that are the bright, shiny objects in the remote patient management space. And as we go do that, I may not see that investment pay off right off the bat. So as an example, for Artera, we just deployed it from a short-term return on investment. It's very clear. We need to figure out how to get appointment reminders to the right patient at the right time and make sure that they can show up. If I can get them to show up, I thereby have now effectively gotten my return on investment, because if a patient doesn't show up, that's all wasted resources. My clinic space, my physician, all of our ancillary services and support staff don't have anything to do for that time period. More importantly, that patient now has to be rescheduled for a month from now, thereby displacing a future patient from getting that appointment, and thereby we have these long lag times and wait times. That short-term investment has paid off for our remote patient monitoring programs. So we have one program that has a short-term investment, or short-term return on investment. It's perioperative care for tonsillectomy, adenoidectomy. We've been able to actually guide a patient from when they see an ENT surgeon to when they actually have their surgery, and post-operatively in the 30 days after their surgery to actually guide them through the whole process, from scheduling a surgery to doing the follow-up care and making sure that they know what's coming. We know that if patients engage in that pathway, they're 50% more likely to get their surgery done at our institution. That's a pretty staggering difference at the end of the day. Great short-term return on investment. Long-term return on investment, we've got a diabetes pathway similar to that. That is going to be more value-based. That's going to be more quality and safety-based. How do I actually see that? It's going to take me years to get there. That's okay. That's okay because I'm investing in these short-term returns on investment. That's funding my long-term. And so if I've got a good balance in my portfolio, I can actually create more of these opportunities. And as some of that long-term return on investment starts paying off, we actually then create a good, strong following of adoption. So our patients are now adopting all of our digital tools. They're actually engaging in all of the tools that we're providing them, and then they're utilizing it to the fullest capability.
Oh, I love that. I love that. The diversified portfolio and especially the utilization to the fullest capability. All right, so tell me this then, Ravi. What does like patient experience Nirvana look like to you? Like what is, I mean, and it's like, I'm really curious to hear this because I mean, it is that you seem to have a very solid perspective on the fact that it needs to blend up in touch, like human experience with the technology. So what does the patient experience Nirvana look like?
Yeah. Seamless. It's got to be something that is simple. So back to my earlier comment, healthcare is complex. Don't ever pass that complexity on to the patient. Let's not make it more difficult for our patients in trying to get the care that they need. Let's try to streamline it as simply as possible. Now, there's stepwise approach to getting there. So making sure that we're not letting perfect get in the way of good, because good is progress. And let that progress happen. It's going to be stepwise, and that's totally okay, especially in the digital space. But how do we make it so that it's simple, streamlined, it's
frictionless.
It's truly frictionless for a patient to be able to get the care that they need. So they need to get the access, they need to actually get the care, and then their post-visit care needs to be something that can be continuous in that experience. And then something that we can guide them with, something that they're not left on their own, because we all have been there. You've shown up to a doctor's office, they've delivered some bad news, or you've been there with a family member, as we talked about with caregivers, and no one remembers what's going on in that moment. Great. All of this stuff was just thrown at you right in that moment. How do we make sure all of that is available post-visit, and not just in some after-visit summary, right? Yeah, and not in a 15-page after-visit summary, but something that's actually going to guide them through what the next steps are to actually make this a seamless experience downstream.
All right, Ravi. Well, we look forward to that. So thank you so much for stopping by and sharing your thoughts with us. I really appreciate it. It's a pleasure to speak with you. That's Ravi Patel. He's the Vice President for Digital Health at Lurie's Children's Hospital in Chicago, my hometown. Got to shout it out. For more interviews with the who's who of health innovation as they are changing the way that we do healthcare, especially the patient experience side of it. You can check out more interviews on my YouTube channel. It's youtube.com/WTF Health. All the episodes that I do regularly are up there, along with some of these special episodes about patient experience filmed here at Artera's Heartbeat event. I'll talk to you guys real soon. Thank you so much. Take care.